Hello, Dr. Satish. Good morning.
Morning.
Welcome to my channel, Sanguine Sharanya, the show. Shall we start?
Yeah.
The first question. Usually, students at class 8 or later classes will have um, confusion on which group to take. So, how do they decide? Is it just based on the interest, or are there any other parameters to decide?
So thank you for having me today on your show.
My
Um,
pleasure.
so, so the first thing is, obviously it depends on the interest of the student. So some students they like biology or like any other sciences. So if they have a keen interest in that area, definitely that is something which they can pursue further by joining the BIPC. Whereas if they're interested in mathematics or if they have more of an analytical brain, they're really good, they're really strong in mathematics, then they can pursue the engineering route. And if someone is still not able to decide, then they can always kind of go into MBIPC to kind of learn more about those subjects. But obviously, doing MBIPC is always going to be a challenge because now you have to learn not only medicine, not only biology, but also you have to learn mathematics. So you're going to actually spend more time, or in other words, you're going to put in more effort to compete with the students who are actually only doing BIPC or MPC. But I think it really depends on the interest. So say, for example, some of the things that come to my mind are if you're interested in handling like a frog dissection or a cockroach dissection. So those are the things which most of the plus one, plus two, the 11th standard and 12th standard students do. So if you're something, if your passion is kind of learning more about those animals and you're able to kind of do them, and if that is where your interest lies, if that is where your heart lies, then definitely I would recommend BIPC for any student.
So you're saying just it is the interest, it depends.
Yeah, it is because like what I have seen here is the students actually join one area because their parents ask them to join, or they're kind of being pressurized to take up one career. They go into that area, they find out that they don't like it, then all of a sudden they change the career tracks. Like for example, I had a classmate who joined BIPC, did not like it. After a year he moved to MPC, so now he lost a valuable time of 1 year during that time frame. I have seen students here in states who have gone through like 6 years of education in a particular area, then they realize one fine day this is actually not for them, then they change career. So now you lost all that 6 years of time, effort, money. You lost all of that. So that's why I would strongly recommend all the students to explore the area where they're interested in. Talk to people. Like for example, if they're interested in medical sciences, if they want to be either a like a medical doctor or a veterinarian doctor, or so they should really kind of do what we call as observership. So they should follow the doctor, or follow the veterinary doctor, or follow the agricultural scientist, or those kind of people. They should follow them and learn what do they do on a daily basis. What does their day consist of? Is this something like they can handle? Like, for example, you hear children sometimes, oh, I don't want to take care of things like a sick person or a vomit or something like that. So some people don't like it, and they will actually get an idea of like following a doctor. They will get an idea of what the day-to-day life is going to be. Likewise, the same thing in engineering sciences, for example, like computer sciences, they can actually go and sit with a computer professional and talk to them, see what kind of fascinating things they do on a daily basis. Like, for example, writing a code is it's a very kind of talent, or it's a very demanding job. So you need to be kind of very creative, you need to work hard, and so if you have that skill set, then definitely that is something you can pursue later in your life. But I think the first and most important thing is have an option of like 4 or 5 different career paths what you're interested in, and then go and explore all of them, see which ones you like the most, and that way you kind of get uh, get to know more about those areas. Like some people are interested in photography, so take some extra courses, like join the basic photography skills, advanced courses, learn more about them, and then see if this is something where their passion is, and they can also not only their passion, but they can also make a living out of it.
Okay. So, um, once the students decide and the parents have a different opinion on, then how do the how do the children convince their parents?
So it's a matter of kind of having an open discussion with the parents, like try to put your viewpoint, like why do you like say for example, like why do you like medical sciences? Like for example, I like this because I want to take care of people, I want to help them at the time of the need, and I am ready to take that long path of studying, and I can support myself like in the later part of the training programs. So you have to have all the positives, why you want to kind of take up that field, and then you have to try and listen to your parents, like what are their points, like why they don't want you to join medicine. So you can actually kind of have an open discussion, open dialogue, and see if we can actually kind of get your viewpoint across to them. But sometimes it can be very difficult if your parents want you to be in a different area and then your passion lies in somewhere else.
Yeah. Some of the parents try to force their children to educate in a different path which they are not interested in. So
Mm-hmm.
that is the very common problem in the students. So
Mm-hmm.
is that only the way? Is that discussing open discussion is only the way in convincing parents, or are there any other ways like that?
I think honestly, open discussion is what all the parents would like, and I honestly don't know anyone whose parents actually made them go into a career path they absolutely hated. The students hate, because at the end of the day, parents want the children to be happy in whatever they do, and they want them to succeed in their life. And honestly, I don't feel like that will be a big issue or a roadblock, as long as you can actually talk to them openly about your career choices.
Okay. At which class should the students start preparation for their inter level and all those things? Like if you see, we take IIT courses for choosing MPC. So at which class we have to start this training for the students who are interested in
See,
the.
the sooner somebody decides on their career path, that will be better. So in my case, I can tell you that I knew I wanted to be in the medical side when I was in 7th grade. So that is kind of a good enough time for you to. So what happened in my case is, at 7th grade I thought about it, then I started showing interest in the science fair, so I participated in all the school and the district science fairs. So that gave me more of an exposure to the like-minded people. Like, for example, when I go to the science fairs, I see all the other students who have a passion in that area. So you talk to them, you learn from them, you develop ideas, and then you kind of, for next year, you'll be much more better at competing at these science fairs. So that is something which I have actually done to improve my chances of getting into the medical side. So all that is knowledge which you can acquire over a period of time. So I think, taking an early kind of lead in that area will always improve your chances. There is no set time. You have to decide by this time or so and so. The sooner, the better. Like, for example, if somebody is interested in kind of mathematics side, or I've seen like people who are interested in the accounting area. They've actually kind of gone into those areas like right early on in their career. More than like how many years you prepare, what really matters is how well you prepare for that. So I've actually seen some physicians who actually did not take it seriously until their like +1, but then the second year of their intermediate, they studied really hard, they're focused, and they were able to get into the medical school, in a medical college. So it really depends on how much focused are you. And so whenever you are aiming for an exam, whether it is now, I think there is no more MSET, it is NEET, I think,
Yes,
so
yes.
national entrance exam. So when you're preparing for the NEET, so my approach would be, the first thing is talk to the people who have already done the test and see what kind of material they've actually used to prepare for that, what kind of books they've used. So make a plan according to that. And always the students will benefit if they actually have a timetable. And according to the timetable, they have to kind of study. So it's not the number of hours they spend studying, it's the quality of the hours you spend is what is really important. So even if you actually stay very, very late until like 12 in the night, but if you're kind of dozing off like those hours and you're not really paying attention, those are practically useless. I would rather you kind of stay very focused and prepare in the right way. And even 2-3 hours is going to be very adequate. And so I think, in my mind, it's actually the focused preparation, exam oriented preparation is what is necessary to succeed. And the most important thing, no matter wherever you go, whether it is you want to be a chartered accountant or you want to be in the medical sciences, the most important thing is, don't forget getting good exercise, getting a good amount of sleep every day. So these two things, unfortunately, students tend to neglect these two things. These are equally important to actually be very focused and concentrate on your education.
Okay. So, in case of the entrance, how many hours can be spent for a day? Actually, you have said that 3 hours is more than enough, but if they are like not able to recollect something like that, so how many hours do they have to spend on studying a subject?
Yeah, so it really depends on the student. Some students, they're really good at grasping the topic. They have they read it once, they have a photographic memory, they can remember. Some students are not like that, so they may have to put in more effort. But ultimately, I think it is for the student to decide, the amount of effort that is needed for them. um, but like, in all honesty, the most important thing is, always keep in mind the exam, what you're preparing for, and then you have to prepare accordingly. So if you just want to just read randomly the books and get all the knowledge, that will not really help in securing like whatever you want to secure. Like for example, if you want to prepare for an IAS entrance exam, I have known people who are like extremely smart. They are not able to get into the IAS because they are not focused on the exam preparation. So anyone, my recommendation is any area where you want to get in, whether you want to get into a bank entrance exam or you want to get into any of those exams, you really need to know what is being tested on those exam papers, what are the areas you need to concentrate, and what are the books you need to read for that. So for that, usually in my case, what I did was I asked probably 5 to 6 students who got into medicine at the time, what are the books they read, what was helpful for them, so that I can actually make up my own mind. Sometimes I had to bring two textbooks from two competing organizations, and then have to go through them and then find out which one is a good one for me. So it really depends on the quality of the hours, not the quantity of the hours you study for an exam.
Okay. So once we get a seat in a college, like whether it is in a BPC or MBBS,
Mhm.
so is it when you take it in the case of the MBBS, is it
Mhm.
really difficult uh, to study MBBS after getting the seat?
So the biggest hurdle is getting into the medical school. That is the biggest hurdle. And then you have to have a passion for the medical sciences. I have seen students who got into the medical college very easily because they know how to prepare for the exam, but their passion is not in the medical sciences at all. So I've seen them kind of not do well in the 6 years, in the 5 years of the medical college education. So eh, in itself is it's like studying during the medicine time, like 5 6 years, you have to put in a lot of hard work. And once you're there, you're competing with the students who are very passionate about medicine, who work extremely hard. So there is no question that on a given day, I think the amount of time at least I spent during my medical school years was at least 8 hours of studying every day after my hospital work, the college classes. So either in the morning and the evening, I had to add up another 8 more hours. So my day was kind of going to be somewhere close to 16 hours every day, with all that education time and everything. So it's really intense. It's definitely not going to be an easy path. And it's not only doing that 5 or 6 years of medical college. These days, as you know, you have to get into the post graduation, which is doing the MD degree. And nowadays, even doing MD degree is also not adequate. You have to super specialize either in cardiology, gastroenterology, or if you take up the surgical specialties, you have to do vascular surgery. So these things, they add another, I would say, easily 6 more years easily on top of your medical school. So it's a long road ahead for people who want to be in medical sciences. So assuming that everybody gets in at each and every step without any breaks, doing medicine is like 5 or 6 years depending on where you're doing it. And then 3 years of MD, 3 years of super specialization. So you're already kind of looking at least 6 plus another 6 years, 12 years after your intermediate. If they can go through, if they can navigate everything like immediately one after another. So that's actually a long time in some people's mind. So if they're not ready to put in that much effort, then they should think about doing non-medical areas. Like for example, engineering is 4 years of doing the engineering work, and then 2 years of specialization. Like it will be 6 years. So you can compare. So in 6 years time, you're already kind of earning, whereas in medical side you have to spend at least like 9+ years to make a decent earning.
Okay. So, are there any? Uh, we have many options after BIPC. So, what are the various options we can choose after BIPC, like MBBS? What are the others we can choose?
So there are a lot of other options. For example, like masters in biotechnology. It's a really upcoming branch. Genetics is an upcoming branch. So people can actually do bachelors in those areas, and they can also do masters. There is a lot of scope for research, not only in India but also abroad in areas like biotechnology, genetics. Um, and in India, microbiology is something done after medical school, but in other countries you can actually do bachelors in microbiology outside the medical college. So you can actually do that, and so that is one area. And then here in states it is extremely competitive to get into the veterinary medicine. So people, like, they want to treat animals, they want to be in veterinary medicine. Then dentistry is another big area with a lot of opportunities, and then great potential for lifestyle. So you have, like, already, like, we came across, like, dentistry, multiple other areas which we just talked about. So there is a lot of other areas you can navigate. Nowadays there is another upcoming branch called healthcare administration. So people who want to pursue the business side of medicine or business side of dentistry, they can also pursue healthcare administration. So you can actually do any of these degrees, then go on to doing a master's MBA. You can pursue that. So being a scientist in any of these specialties I talked about is also an option. So there are a lot of possibilities once a person goes into the BIPC. And obviously, like, even if you go to BIPC, you can always take up the IAS or IPS exams. Although people actually chose non-medical sciences as their topics of an expertise or something. So you have all these different areas where people can look into on the BIPC side.
So, as you have said just now, so you have said the various options we can choose after BIPC. So, can you share some specializations like we can do after the MBBS or BDS, whatever it is?
Yeah, like for example, DDS. I don't know how many years it is. It used to be, I believe, um, 4+1, I think, years. Plus nowadays, again, you can actually do masters also. So I think you probably have to check with somebody who is practicing in that area. But I think the timeline is definitely kind of comparable to an engineer. So 4 years plus, I think, 2 or 3 years. The same with veterinary medicine also. You can actually do 4 years or 5 years. So I think these timelines change from time to time, but none of them are going to be long as in MBBS. None of them. They're always, all of these other options, they're definitely shorter. Like for example, if you want to do microbiology, 3 years of bachelor's degree and then 2 years of master's. So it's definitely shorter time frame.
So, what are the various specializations after MBBS? Like,
So
like
after MBBS, the most
so,
important thing would be to decide on where you're going to be. Like, for example, medical specialties. Like when I say medical specialties, all the areas like cardiology, gastroenterology, oncology, pulmonary medicine, all of them come into that area. Geriatrics, like taking care of elderly people, is another area also. So outside medicine, then there is surgical specialties. You have, like, again, gastrointestinal surgeon, oncology surgeon, neurosurgeon, they specialize in brain area, cardiac surgeon, they specialize in cardiac area, thoracic surgeon. So you can basically, for each part, you can specialize in all these areas. So again, depending on the area where you want to train, for example, cardiothoracic surgery training is like 6 years in some countries. So it is a very lengthy training compared to the medical specialties, the surgical specialties. The training is even more kind of prolonged. Then you have radiology. These are the people who look at the X-rays, the CT scans. So they basically kind of sit in. So nowadays, with all the modernization, you can basically sit at home, read all your patient scans from home. So that is a good option for somebody who wants to work from home. This is the only medical area where you can practically work from home. So which is radiology. Then the other one is obstetrics and gynecology. So taking care of women. The pediatrics is another area, taking care of children. So these are all different areas inside the medicine. Like after doing MBBS, you can specialize in all those different areas.
Okay. So now a bit funny question.
Mhm.
Why need do students need to cut the animals being a vegetarian? Will it be okay like that?
So it is actually a very good question, as to should we do it or can we actually learn whatever we need to learn from the 3D videos, or if they do like one dissection, can they actually use the video and show it to all the all the other students? That's actually a very good question. I don't know the answer to that. So my take on that is, like, for example, when I was doing all the dissections during my medical school years, so I knew that I'm not really good at the surgical aspect of it. That's when I decided I'm going to be in the medical specialties. But without doing that, the hands-on kind of, so as to say, sometimes it's hard to know, do you have the necessary skill set, do you have the necessary expertise in that area? So I think, I'm kind of completely torn. On one side, I see your point being like some people being vegetarian, they are really passionate about not wanting to harm the animals, but at the same time, that also gives you a good idea for the student to decide, okay, do they have fine dissection skills or do they not? So it gives them a good idea if they can handle something like that in the future.
Okay. So as you are a experienced doctor, I just wanted to know uh, how will how will the work life of a doctor will be balanced with the personal life, your family life, and all those things. How
So
do you
again,
balance?
yeah, again, in India, it is definitely a challenge for a physician, because um, like people actually, most of the doctors I know in India, they always complain about not having a good work life balance. But I think, in my opinion, that is something which any physician or any person can control in their life. So nobody is going to actually say you have to actually work. Uh, if I say I'm actually closing my practice at so and so time, then you can actually close that practice at the time. But I think most of them feel obligated to care for their patients around the clock. They take the calls even at nighttime and everything. So that is where the systems abroad, they're actually much better in trying to kind of give a good work-life balance for the physicians. So that's a challenge for the physicians who are practicing in India.
Okay. Thank you so much for spending your valuable time and answering our questions.
Yeah, thank you for having me today, and all the very best for your career.
Thank you. Thank you.